Welcome to You Multicultural and Doc Talk Manitoba project. This is Jyoti Kalsi, your host, and today we have Dr. Denise Koh. Welcome to the show.
Thank you.
Dr. Denise is Chief Occupational Medical Officer at Workplace Safety and Healthcare Manitoba. I will still let Doctor introduce herself and provide us more information as to what is her role during this pandemic and how she's making sure that we all can be safe. Welcome to the show.
Sure, thanks for having me. So my role, I've got two roles with Manitoba government. The first one is the Chief Occupational Medical Officer, or COMO for short, and that's with Workplace Safety and Health. And then I'm also a medical officer of health with population and public health, which is also with the government of Manitoba. So I've got basically two different roles. And basically during the pandemic, I've been focusing mainly on workplace COVID issues. So, that would include creating guidances for, managing workplaces, recommendations for workplaces, how to keep them, minimize that risk.
Right.
I've been helping to, with some of the higher risk workplaces and worker groups. So
Right.
Food processing is one of the examples where I've been working very closely with the Department of Agriculture.
Right.
And then, temporary foreign workers. So, all sorts of different types of worker groups that are at higher risk of, COVID infection or outbreaks. And I've been helping to, manage those issues and the public health management of those. And basically any questions related to workplaces that have been coming to me. So
Yeah,
very busy.
100%, because those are the major concerns people have right now. How can we get back to normal life and still,
Yeah.
be making sure that everything is taken care, we all feel safe, and everybody feels comfortable coming back into those workplaces. So that's what the intent of this series is. We want to address those questions and rumors that we have in the society, so people can get that information from this series and feel comfortable. So if you are ready, we can get into the questionnaire and start tackling those.
Sure.
So the first question I have is, what sectors of workplace require mandatory vaccination? Like, which sectors do you think are most at risk?
Well, currently it's not really mandatory vaccination. It's more of a mandated testing protocol or program.
I see.
So currently the public health orders are for the public service sector. And so that would include healthcare workers, schools, and public servants.
Okay.
And basically, they are required to undergo regular testing up to 3 times per week if they are not exempt. And being exempt would be if a worker has provided proof of full vaccination.
Okay.
So, it's not quite mandated vaccines because there is an option for those who are not able to get vaccines or do not choose to get vaccines.
Okay. But is there certain sectors you think that this is crucial? Like, I know you mentioned public servants is one of them because you want to make sure those are frontline workers, right? Yeah. Is there any other sectors or industry you think this is crucial for them to get vaccine? Like you mentioned food industry as well, I think.
Yes. So, I mean, there's a number of different risk factors that, increase the risk of workers in that workplace. And so, currently the orders only apply to the public service, but there are other sectors that, have increased risk and where, we would recommend, considering mandating vaccination or, really increasing those control measures in the workplace.
Okay.
So, food processing is one good example.
Right.
Where there's, very limited ability to social distance in some of these, plants.
Yes.
So, there are a lot of different aspects. So, I mean, temporary foreign workers was one example, where they have unique risks related to, the travel and, crossing the border and that kind of thing. So, I've helped to manage that. The work camps in Manitoba, that's another area where they have not only potentially congregate work settings, but also they're living together at the camp, so that also increases the risk.
Risk as well.
Healthcare workers is another example where they're dealing more with COVID patients, so
They're in
they're
direct
at
touch with
much
them, yes.
higher risk.
Exactly.
So there's a number of different factors that increase the risk. I divide them into workplace factors and then worker factors.
Right.
So workplace factors would be like, congregate settings is one that we've had a lot of difficulties with.
Right.
Certain industries, as I mentioned, in certain sectors, if the workplace has a critical service or essential service where they're not able to shut down, then that also increases the risk.
Yes.
Because these workers are not able to work remotely, let's say.
Exactly, yes.
So, and also the types of control measures that the employer has put into the workplace, if there's not enough of those measures in place, then that could also increase the risk.
Yes, as well.
When it comes to worker risk factors, the biggest one right now is vaccine status. So the unvaccinated workers are the ones that are at the highest risk.
Yes.
And when we talk about risk, we talk about risk of getting the infection, but also risk of suffering from severe disease
Right.
or death from
Yes.
the infection. So there's
Right.
kind of two things to look at.
100%, yes.
Other factors as well could be, if their workers are not able to maintain that social distance or have high frequency of contact with, patrons or other workers, that increases the risk. And then one thing that we've also noted from our data, a couple of things, is that BIPOC individuals or people who identify as BIPOC, they're at increased risk of both getting the infection and suffering severe disease. And then as well, lower socioeconomic status individuals also have that. So
Right.
workers in those sort of categories, may also suffer or be more at risk.
Yes.
And then we still have our other risk factors, which, age is a huge one.
Yes,
So the older
yes.
workers, over 60 particularly.
Right.
Those who have medical conditions or immune compromise as well, they're also at higher risk.
Yes, of course. When it's also it's just not only just a certain group that you can identify. It's just when you are exposed to other people, different age, what immunized level they have, it just plays a big role in that as well. So usually there's a question, like in the community, you'll hear that, do I have to get vaccine if my employer asks for it? And if I don't want to go for vaccine, what else procedure can you go for? This is a question that you will hear often, right?
Yeah.
So how would you guide or give them, a guidance to go for?
Well, there are certain work situations where vaccines are, mandatory or are required, and that's really up to the employer to make that call.
Right.
And it really does depend on the control measures that they have in place in the workplace to mitigate that risk. So, healthcare is a good example where, vaccines have been mandated for, vaccine preventable diseases to prevent that transmission of infection to the patients as well as to their coworkers.
Right.
So, that's a good example. But there are other control measures that employers and workers can use. The employers have a requirement legislatively to perform a risk assessment of the workplace and then implement reasonably practicable measures, like control measures, to mitigate that risk.
Right.
So it's important for workers to be aware of what those policies and requirements are.
Right.
Comply with those,
Right.
and then also to, if there's recommended PPE or personal protective equipment,
Right.
in this case we're talking about masks generally,
Right.
To follow that along with those as well.
Right.
So, it really does depend on the workplace and what measures they have, but it's really important for workers to know that. And then, of course, also to get vaccinated. That's, the biggest way to prevent the infection and protect us all. So that's number one.
100%. These procedures does give you a substitute, but I think the end goal is still to get vaccinated because that's the end. And we have known and we have tested it out that it's been working, right?
Yeah.
So, but when some people still ask, my workplace doesn't call for vaccinations, right? Or they don't have any test programs, what can they do?
Well, there's different types of control measures. It could, important ones include what are the public health recommendations: social distancing, staying home when sick, good hand hygiene and cough etiquette. Getting vaccinated is now our big one. There's engineering controls that the employer can use. So that could be, if for instance social distancing isn't really they're not able to social distance properly, they can implement, barriers like the plexiglass barriers that, between workers and between, workers and patrons. Ventilation, looking at the ventilation and making improvements to that. Administrative controls like, the working from home arrangements that are occurring. That's a good example. Environmental cleaning, that's also important. Cohorting the workers, and so that basically means keeping them into groups that are predictably exposed to each other, as opposed to, exposing that worker to everybody in the workplace. And then, PPE and wearing the masks. Right now we have the mask mandate, so that's another added layer to help protect, decrease our overall risk to the COVID infection. So.
Right. No, that's definitely valuable information. And although, that's been in place, people have been trying to use it since a year, but I guess refreshing it all, coming it from professionals like you who have been working on it in and out for this last year really helps and, makes it more concrete that these are available options for you. But again, I would say, and you can also make it a call for our viewers and listeners that, how vaccine is important. Like, what do you have to say to support it more?
Well, if you look at the hierarchy of control, so that's basically going from the most effective to the least effective type of controls. Basically, vaccine is at the top of that pyramid. So really, that's the best way to prevent the infection from getting into the workplace, but also preventing that transmission. If it's not in the workplace, and the workers are immune and safe against that, that's the best way to protect. But then there's other things that can be done to also decrease that risk. So, the spacing, hand hygiene, staying home when sick, that's very important as well. And also the masks, very important as well. But it's important to not just rely on that. Really, the vaccines, again, that's where we put most of our eggs, is into the vaccine basket, because it's so effective and it is safe. And it really is our only way out of the pandemic. So, I urge everyone to get themselves and their loved ones vaccinated, and as well, help others who are not vaccinated to get vaccinated as well. So.
100%. We cannot say it enough. Before we end this session, I know some people have this question, because many executives or even on other jobs, people have to travel for their work, right? So what is the mandate, or what do you recommend for the quarantine requirements for them? Because they're traveling for work, but they're still traveling, right?
Right. Well, it depends on a number of things, and it's important to also realize that, every day, sometimes daily, we have to make changes that reflect what our circumstances are. So there are changes that are occurring. Currently, right now, there is a public health order whereby individuals that are either returning to Manitoba or coming into Manitoba, they must undergo self-isolation or quarantine for 14 days. And then there is a recommendation to get testing on the day of arrival as well as on day 10. That's for those workers that are not, or people who are not exempt. So right now, vaccine is, being fully vaccinated is an exemption. So that really does help, travelers going out there and then coming back. And then also, it also depends on where you're going and, when you leave as well as when you come back. So it's always important to check what those requirements are. If you're coming in from out of country, there are also federal requirements as well. So there may be federal requirements as well as provincial requirements, so it's important to look at both.
Awesome. Thank you very much. Thank you again for your time.
My pleasure.
To share this information with U Multicultural and DocTalk Manitoba project. Again, I want to also take a moment to thank you, Manitoba government and Doctors Manitoba, who provide special help to all the doctors and physicians to offer exceptional service to Manitobans. Stay tuned with DocTalk Manitoba project with U Multicultural to get answers to all your questions about COVID-19 vaccination. Thank you.